My name is Ken Hohmeier. I'm a community pharmacist by training and by practice. So what that means is I am one of the neighborhood pharmacists that you can see in any community in the United States. What's exciting right now about community pharmacy practice is just the increasing amount of new opportunities that are available for community pharmacists and students who are interested in community pharmacy. I think if one thing the pandemic has taught us, it's that community pharmacists are ready to step up to do more than we ever have before. Some of the research that I think would be interesting to prospective students and some of the students here in the college right now is the work that we're doing to implement new patient care services in existing community pharmacies. And that's exciting because 95% of Americans live within 5 miles of a community pharmacy. So we're a major access point that's really not being utilized to the level that we should be. So what we want to do is take this very highly trained, accessible, doctoral level pharmacist that's in most every community in the United States and make them accessible to a large degree of patients for a large degree of services. This may include things like point of care testing like we saw through the pandemic. It can also be things like managing chronic care diseases like diabetes or high blood pressure. A lot of the work that I'm doing right now is about how do we take some of these patient care services, implement them into existing community pharmacies in a way that's feasible for that pharmacist, and see what it does for patient care outcomes. And we've seen great things across many of our projects. The biggest one right now that we've worked through is a partnership with the Tennessee Medicaid Department, where we have implemented a patient care service, medication management program for the most underserved among us. And these patients across Tennessee have been provided access to a medication therapy management pharmacist, where they're actually providing care in a prospective manner to those patients, which is really exciting. And they're doing this under a collaborative practice agreement, which means not only can that pharmacist take care of the patient in that appointment through counseling and the typical things a pharmacist can do, but it means the pharmacist is also prescribing therapy, changing therapy, ordering and interpreting labs. And that's really what we're trying to train our pharmacists to do in the first place. So a very exciting project there. We're building the first bridge between a community pharmacy software system and a medical EHR, electronic health record. What this means is that community pharmacist can chat or email directly to that prescriber when there's questions about patient care related items. It also means that we can see their records and they'll be able to see our records too, which means a higher level of patient care for both sides. And that's a first, and that's right here at the University of Tennessee.